GERD is also known as gastroesophageal reflux disease, is a disease where we have the contents from your stomach, essentially acid, food, bile, that can actually go backwards up into the esophagus, so it can cause damage to the esophagus. I would say almost everyone has some symptoms, heartburn here or there, maybe you have to eat a large slice of pizza or something like that, but where it becomes concerning if you have more persistent or frequent symptoms of acid reflux, so heartburn that occurs frequently, you have food that comes back up, then it's important that you see a doctor to evaluate the symptoms because they can cause a lot of damage to your esophagus over time. So you're a good candidate for surgery when you've been on medication, if the medication is not controlling your symptoms. If we think that the risk of long-term medications outweighs the risk of surgery, if the GERD or acid reflux is negatively impacting your quality of life, or if we identify something with the anatomy that could be fixed surgically, such as a hiatal hernia. There are a number of surgical options to treat acid reflux. These start from minimally invasive, even endoscopic options, to minimally invasive surgical options such as laparoscopic surgery or robotic surgery. Most of these options are focused on improving that lower esophageal sphincter, or that valve between your stomach and your esophagus. And we can do this in a number of ways. If we need to fix a hiatal hernia, which can be a factor contributing to your acid reflux, we can do that for you. Essentially, strengthen that valve or that lower esophageal sphincter, and we can do this with what's called a fundoplication, where we wrap part of the stomach around the lower part of the esophagus. Or we could do this with a novel device. This is the Lynx. It's a magnetic sphincter augmentation that is calibrated to separate, to allow the food bolus to pass through. And then when you're not eating, it snaps closed and prevents that acid, the food, the bile from going backwards into your esophagus. So these procedures are covered by most insurance plans. Here at Advanced Surgical, we are one of the most experienced practices in New Jersey. We have offices stretching all the way from Essex County to Ocean County and everything in between. Please call us today for an evaluation.